Imagine waking up at 3 a.m. with an urgent need to use the bathroom. You rush there, expecting relief, but instead feel a burning sensation that makes you wince in pain. Just a few drops come out. 2 hours later, you're back again, with the same burning urgency, the same disappointment. This isn't just a bad night. Your body is sending you an SOS. What if I told you that this common experience, one that affects over 150 million people worldwide each year, is not only misunderstood by most who suffer from it, but also frequently misdiagnosed even by medical professionals? Let's start with something that might surprise you. According to research published in the New England Journal of Medicine in 2023, nearly 1/3 of UTIs don't present with the classic symptoms we've all been taught to watch for. So what are these classic symptoms? Most people know about burning sensation during urination, frequent urge to urinate, often with little output, cloudy or strong-smelling urine, and pressure or pain in the lower abdomen. But here's where it gets interesting. A landmark study from the University of California, San Francisco tracked 1,200 patients with confirmed UTIs and found that many experienced what researchers called shadow symptoms, signs that were frequently attributed to other conditions, causing dangerous delays in treatment. These shadow symptoms include fatigue that seems disproportionate to your activity level, low-grade fever that comes and goes, lower back pain that's often mistaken for muscle strain, and mental confusion in older adults, a symptom that's frequently misdiagnosed as early dementia. This last point deserves special attention. A groundbreaking study published in Clinical Infectious Diseases followed 3,000 seniors over 5 years and found that UTIs were the most commonly missed infection in elderly patients. When a UTI reaches the bloodstream, it can cause rapid mental status changes that are often misattributed to cognitive decline or stroke. In fact, researchers at Yale School of Medicine documented cases where patients were actually being evaluated for Alzheimer's disease when the real culprit was an untreated urinary tract infection. Once the infection was addressed, the cognitive symptoms completely resolved. But why are UTIs so common in the first place? The anatomy tells the story. In women, the urethra, the tube that carries urine out of the body, is only about 1.5 inches long, compared to 8 inches in men. This shorter distance gives bacteria an easier path to the bladder. This anatomical difference explains why women experience UTIs up to 30 times more frequently than men. In fact, according to the Journal of Clinical Medicine, more than 50% of women will develop at least one UTI in their lifetime, with 20 to 30% experiencing recurrent infections. Speaking of recurrence, let's talk about a phenomenon that frustrates millions of people, the UTI that never seems to fully go away. You take antibiotics, feel better for a few weeks, then suddenly the symptoms return. What's happening? Recent research from Washington University School of Medicine has uncovered something remarkable. Using advanced imaging techniques, scientists discovered that certain bacteria can actually form protective shields inside the bladder wall where they hide from antibiotics. Once treatment stops, these bacteria emerge from their hiding places and re-establish the infection. This discovery has revolutionized how we understand persistent UTIs. It's not that the treatment failed or that you caught a new infection. It's the same bacteria, employing a sophisticated survival strategy that scientists have only recently been able to visualize. But the science around UTIs gets even more fascinating. A groundbreaking study published in Cell in 2024 revealed that your blood type actually influences your susceptibility to certain UTI-causing bacteria. People with blood type B are 50% more likely to develop recurrent UTIs than those with type O, while blood type A falls somewhere in between. This genetic component helps explain why UTIs seem to run in families. It's not just about shared hygiene practices or behaviors, but actual genetic predisposition. Now, let's talk about something that doesn't get enough attention: the differences in UTI symptoms across different populations. While the medical literature has traditionally focused on how UTIs present in younger women, recent research has highlighted important variations. In men, UTIs often manifest with rectal pain or pressure, painful ejaculation, and epididymitis, inflammation of the coiled tube at the back of the testicle. In pregnant women, UTIs frequently present with no symptoms at all, asymptomatic bacteriuria, or more severe systemic symptoms like high fever and an increased risk of preterm labor. And in children, the symptoms can be particularly challenging to identify. Irritability without obvious cause, feeding problems or poor appetite, new-onset bedwetting in previously toilet-trained children, vomiting and diarrhea that mask the urinary symptoms. These population-specific presentations were documented in a comprehensive review in the Journal of Urology, which analyzed symptom patterns across 15,000 confirmed UTI cases. Now, I want to share something that might completely change how you think about UTIs. For decades, we've been told that bacteria from the digestive tract are the primary cause of these infections. But emerging research is challenging this long-held belief. Scientists at Loyola University Chicago made a groundbreaking discovery in 2023. Using advanced genetic sequencing, they found that the bladder itself, previously thought to be sterile, actually has its own microbiome, a community of bacteria that normally live there in balance. This revelation is transforming how we understand UTIs. Rather than being a simple case of external invasion, many UTIs may actually represent an imbalance in the bladder's existing microbial ecosystem. This explains a puzzling phenomenon: why some people with high levels of bacteria in their urine have no symptoms at all, while others with relatively low bacterial counts experience severe symptoms. It's not just about the presence of bacteria, but about the specific balance of different bacterial species. Even more fascinating is the connection researchers have found between the urinary microbiome and the gut microbiome. A study in Nature Microbiology demonstrated that changes in your intestinal bacteria, triggered by diet, stress, or antibiotics, can directly influence the bacterial balance in your bladder. This connection helps explain why probiotics have shown promise in preventing recurrent UTIs in clinical trials. By restoring balance to the gut microbiome, these beneficial bacteria may indirectly help maintain a healthy urinary microbiome as well. But perhaps the most surprising finding comes from researchers at Stanford University, who discovered a bidirectional relationship between UTIs and mental health. Their study, published in JAMA Psychiatry, found that people with anxiety disorders were 30% more likely to develop UTIs, and conversely, people with recurrent UTIs were 40% more likely to be diagnosed with anxiety or depression. This isn't just correlation. The mechanism appears to involve the hypothalamic pituitary adrenal axis, the body's primary stress response system. When activated by chronic stress or anxiety, this system can suppress immune function, making you more vulnerable to infections. And the inflammation from recurrent infections can trigger neurochemical changes that exacerbate anxiety and depression. This mind-body connection explains why some people seem to develop UTIs during periods of high stress. It's not just coincidence, but a physiological relationship that's now being backed by scientific evidence. Now, let us address something serious. While many UTIs are uncomfortable but ultimately manageable, there's a dangerous progression that you need to be aware of. When a UTI isn't treated promptly, the infection can spread from the bladder to the kidneys, a condition called pyelonephritis. This transition often brings new symptoms: high fever, above 101 degrees Fahrenheit, shaking chills, nausea and vomiting, pain in your side, back or groin, and lastly, extreme fatigue. A study published in Critical Care Medicine found that 15% of all sepsis cases, a potentially life-threatening condition caused by the body's extreme response to infection, begin as simple urinary tract infections that were either untreated or inadequately treated. This progression can happen with startling speed. Researchers at Massachusetts General Hospital documented cases where patients progressed from initial UTI symptoms to life-threatening sepsis in less than 48 hours. This risk is particularly high in elderly patients, pregnant women, and those with compromised immune systems. But there's another risk that's rarely discussed: the growing problem of antibiotic resistance. A global surveillance study published in The Lancet found that over 30% of UTI-causing bacteria are now resistant to commonly prescribed antibiotics. This means that even if you recognize your symptoms early and seek treatment, the standard antibiotics might not work, and repeated courses of ineffective antibiotics only further the development of resistant bacteria. This growing crisis prompted the World Health Organization to list UTI-causing bacteria among the pathogens posing the greatest threat to human health due to antibiotic resistance. So, what can you do with all this information? Hydration remains one of the most effective preventive measures. A randomized controlled trial published in JAMA Internal Medicine found that women who increased their water intake by 1.5 liters per day reduced their UTI frequency by 48% compared to the control group. The mechanism is simple. Frequent urination helps flush bacteria before they can attach to the bladder wall. Cranberry products have long been debated, but recent meta-analyses have clarified their role. A systematic review in the Journal of Nutrition found that cranberry products containing at least 36 milligrams of proanthocyanidins, PACs, the active compound can reduce UTI recurrence by about 30%. Probiotics show growing promise. A 2023 clinical trial in the European Journal of Clinical Nutrition demonstrated that specific strains of lactobacillus bacteria, when taken orally, reduced UTI recurrence by 43% compared to placebo. These beneficial bacteria appear to help maintain the vaginal microbiome, preventing the colonization of UTI-causing bacteria. Post-intercourse urination has strong scientific backing. A prospective study following sexually active women for 3 years found that those who consistently urinated within 15 minutes after intercourse had a 70% lower risk of developing UTIs compared to those who didn't. For those currently experiencing symptoms, the latest research suggests don't delay seeking treatment. A study in the British Medical Journal found that every 12-hour delay in appropriate antibiotic therapy increased the risk of progression to kidney infection by 15%. Complete the full course of antibiotics, even if symptoms resolve early. Researchers at the Mayo Clinic found that stopping antibiotics prematurely was associated with a 38% higher risk of recurrent infection within 30 days. Consider requesting a urine culture even if your doctor prescribes antibiotics immediately. A study in Open Forum Infectious Diseases found that targeted antibiotic therapy based on culture results reduced treatment failures by 40% compared to empiric therapy alone. For recurrent UTIs, discuss prophylactic strategies with your healthcare provider. A landmark study in the New England Journal of Medicine demonstrated that low-dose prophylactic antibiotics reduced infection rates by 85% in women with frequent recurrences. Understanding the complex science behind UTIs isn't just academic, it's practical knowledge that could save you from unnecessary suffering or even serious complications. If you found this information valuable, please share it with others who might benefit. Hit the like button to help more people discover this content, and subscribe to our channel for more evidence-based health information that could make a real difference in your life.